Hello, my name is Dr. Stephen Weitz. I'm one of the interventional cardiologists at Ellis Hospital. The purpose of these videos is to maintain a learning tool in order to help everybody taking care of post-cath management, femoral and radial artery sites that may have potential bleeding. The first segment I would like to talk about and demonstrate is how to deal with any bleeding at the site of a femoral access. When a patient returns from a femoral vascular access procedure, it's very important to monitor the site in the first hour very closely. Often, one can triangulate the gown so that the site and the bandage that is on the site can be seen readily, and it can be noted right away if there's any bleeding. If there's any bleeding, there can be a few types of things that can happen. The artery itself can bleed. That's often a pulsatile large volume bleed, which is an emergency procedure to stop. If a large amount of blood is coming out in a pulsatile fashion, it's very important to immediately put pressure on the area. Often, if you must remove the dressing, and you must find the puncture site. Usually 1 to 2 centimeters above the puncture site in the skin is where the artery was accessed. Firm pressure to maintain control of the bleeding site and prevent hematoma is very important. Another person should call for medical doctor attention immediately. Either the doctors in the cath lab, pertinent to the cath lab, or the doctors in the vascular lab can be called if it's a vascular lab procedure. Additionally, one of the PAs who cover the unit or the floor where the patient is can be called right away. These large volume bleeds that can happen from the main artery are very important to seek help right away and bring together a team that can manage the situation. The firm pressure should be held for 10 to 15 minutes, and the best technique to do is keep your arms straight instead of bent and use a gentle lean for holding point pressure on the site to make sure there's no bleeding. Monitoring vital signs, heart rate, is very important because people can sometimes become vasovagal during these situations. If there's a minor bleed or a trickle, if you will, on the bandage, it's important to realize you don't need as much firm pressure. Typically, if there's a trickle or a very minor ooze from the leg that is not pulsatile, one can go to the bandage, remove the bandage with clean gloves on the site, and hold pressure with a 4x4 gauze to put gentle to moderate pressure to prevent the minor tract oozing that may represent. That should be done for 5 to 10 minutes with mild to moderate pressure, not to occlude the blood flow in the leg, but just to compress the tissue enough so that tract oozing will stop. The most important thing is to realize for any of these situations, be it a larger type of bleed that's pulsatile from the artery or from the tract, is that a pressure bandage or putting a weight on the groin and not monitoring it with manual pressure is not the best way to proceed. Often we see in the unprepared individuals that one is not holding manual pressure, which is the hallmark of success to stop these bleeding sites. I'd like to talk about the FemStop device, which is a device that enables us to put prolonged pressure on a site if a large bore sheath has bled. And the FemStop device consists of a belt that goes underneath the patient and is secured with relatively even torque from both sides by putting the belt through the clips and positioning the FemStop bulb over the puncture site of the femoral artery and tightening the belt so it's not moving, and then you inflate the bulb so that pressure is positioned over the artery so you prevent bleeding. And as always, whenever you're compressing an extremity, you must monitor the distal pulse or the plethysmography on the distal extremity. That's very important in the smaller vessels as well, and we'll move on in the next segment to talk about radial artery bleeding site issues and how to compress and prevent problematic bleeding post-radial catheterization. The timing of the FemStop is determined by the team managing the patient. And one caveat is if an immediate response from a doctor or a PA on the service that did the procedure can't be found, it would be helpful to call a code orange if there's a major bleed from a femoral site, which can become very significant dangers to a patient, especially if a large bore sheath was in place with some of the structural heart disease procedures we are starting to do here at Ellis Medicine. I'd like now to talk about the radial artery sites that we may see in post-op management. The radial artery is more often an access site nowadays, and it's very important to know how to manage the radial artery site. Often people will come back with a radial artery band that's in place and inflated with orders to deflate after a 90-minute or 120-minute time frame. The radial artery band in the cath lab is placed by putting a Velcro band in place, and the band is typically over the radial artery puncture site with the pillow that's inflated about 1 centimeter above the skin puncture site, so that the skin puncture site is covered by the pillow that inflates pressure and also covers the radial artery where it was punctured. The inflation site can be inflated or deflated by a special syringe. The cath lab will usually have that inflated to a proper level, and it will be deflated gradually and allow the pressure to dissipate, and then the band is removed in the appropriate amount of time. If there is ever any bleeding in the radial artery site, one must realize that the radial artery can bleed a significant amount, although it's not as large bore as the femoral, but it's very important to stop the bleeding because you can have significant loss of blood. You can have hematoma in the arm. Getting control of the radial site is very straightforward. You identify the radial artery site that's bleeding, you put firm pressure with 3 or 4 fingers above the skin puncture site along the radial pulse, and you monitor for any bleeding from the site and any development of hematoma. And typically you would want to determine 10 to 15 minutes of pressure without checking to have firm pressure on the radial site to afford a chance for a clot to form at the arterial puncture site. Additionally, monitoring the plethysmography on the thumb, which is closest to the radial artery, is very important to make sure that there's good perfusion of the hand from the collateral ulnar artery. These things are very pivotal in a successful radial artery catheterization program, and we encourage everybody to study these videos to learn the skills needed to monitor these sites when they recover post-op.